Before we start, I would like to ask your help to hit the like button, hit the subscribe, and smash the bell. Smash like Hawk. 欢迎来到流水，刘医生吹水。
Everyone, thank you for joining us today. Doctor, are you in?
Hello.
Hi, Doctor. Are you? Can you turn on your video?
Wait. Turn on video. Yep, turning on.
All right.
Hi.
Okay. Perfect. All right. So a very good afternoon and welcome to the Tea Chat with Dr. Loh Kapin today. So we're very honored to have him with us today. Before we begin, our heartiest congratulations to all mummies and daddies on their newborn addition to their family. The journey to parenthood is not easy, but there is always help available to you to help smoothen your journey. So while you have been doing research on parenthood, you possibly may have had questions that you can't find answers to, right? So today is your chance to speak to our doctor freely and directly. So you can ask him anything related to baby care, all right? So mummies, we recommend that you turn on your camera so that we can see each other. However, to ensure that the audio is clear for everyone, we ask that you mute your mic and then only unmute when you want to speak. And we understand if you are shy, you can also just type your questions into the chat and then I will read it out loud for you. All right, so for mummies who are also more comfortable with asking their questions in Chinese, you may do so as well. And doctor, you can answer in both English or Chinese or both. Okay, so 如果妈咪们如果要用华语来问问题也可以哦，然后医生也可以用华语来回答你们。So without further ado, so let me introduce Dr. Loh Kapin. So Dr. Loh is from Penang and he is a trained gynecologist, keyhole surgeon, and also dedicated obstetrician. So today, Dr. KP Loh, who also goes by Gynae Penang, has kindly lent us 1 hour of his time to join us for this tea chat. So better not waste this opportunity to speak to him directly. So does any mummy have any questions to start with first? So I guess we'll just give the mummy some time. Maybe, doctor, since you wanted to speak about the COVID-19 vaccinations for mummy, do you want to just give like a brief overview of how it would impact a mummy if she wants to get vaccinations?
Well, maybe a bit of correction. Just now you were saying that asking me about baby care. It's not asking me about baby care, more of asking me about mommy care.
Mommy care, yes. My apologies, my bad. Mommy care.
Okay. So maybe I just wait for the question to come first, then I see what I can answer. Okay. Any question that coming in right now, or
do we have any mummies who want to ask questions?
I think everyone is shy.
Yeah, everyone is shy.
Usually when you we have one.
Okay, so we have our first question.
Okay, I'm going to labor soon in 9th of June. When can I take the vaccine? Okay, my question to her is how you know you're going to go into labor in 9th of June? Okay, so maybe the reason you're going in labor is because you have an induced labor. Okay, means you give induction, right? Cesarean. All right. So it's a planned cesarean. Then usually after delivery, you are considered as a postnatal or breastfeeding mother. All right. So for postnatal or breastfeeding mother, all the vaccine is actually safe for breastfeeding mother. Okay. Especially Pfizer. Okay, as for the AZN, they already recognize the reason of the high risk is because of blood clots, and then I'm not sure which version are we having, because I think the AstraZeneca, they say they are fixing this vaccine problem and they are reducing the risk of the blood clot by taking away some of the components of the vaccine. Therefore, if you are going after Caesar, if you are going for the AstraZeneca, it must be after 6 weeks, because during post-delivery 6 weeks, your risk of blood clot is high. So if you are high and you take AstraZeneca, then you'll be higher risk of birth clot. Therefore, post-delivery, the safest is still Pfizer. As for Sinovac, you can take as well because you're not pregnant anymore. And then, of course, from us, because Sinovac is a China vaccine, we don't have much data coming from China. So I would still advocate you to take the vaccine after 6 weeks post-delivery. If it's Sinovac and AZ, but if it's a Pfizer, you can take immediately after. But of course, because you're doing cesarean section is a surgery. So after surgery, you need time to recover. So at least I think for recovery, you need 4 weeks. So it's like after confinement, then you take the COVID-19 vaccine. All right. Yeah, do I answer you? Okay. So the next question is if mommy from Danielle, it's a direct message which is not in a regular chat. Let me just copy it to the main chat so that everyone can see the question. So from Danielle is saying that if a mommy had infected and recovered from COVID, how soon can be vaccinated? All right. So the CDC has a guideline about vaccination post-infection. Okay. So if you are infected and you have recovered, means that you are not infectious anymore, you should be vaccinated as soon as possible. However, if you have received some kind of immunotherapy, then you need to wait around 3 months later only you vaccinate yourself. But for this immunotherapy, very rarely used in Malaysia unless you are very super VIP and they use it for you because it's quite an expensive medication. All right. So does that answer you? Okay. So we have a question from Sherlyn Lim. Okay, I'm actually a half banana. I can speak, I can listen to Mandarin, but I can't read very well. Maybe Anne, you can help read the question from Sherlyn.
All right. So Sherlyn Lim is asking, right now she is breastfeeding. Is it
Mandarin? I can understand. You can read me Mandarin.
请问我现在哺乳期可以打疫苗吗？
可以，哺乳就是在喂母乳了，对不对？所以如果你是喂母乳的话，跟我之前第一个问题打过了。所以如果你是那个 Pfizer 的那个疫苗，你是可以打，但是看你是开刀过后，你就等你那个开刀的那个伤口康复过后你才打，过了4个星期。如果是那个 AZ 的疫苗和那个 Sinovac 的疫苗，最好是过了6个星期。AZ 的疫苗最大的问题现在是他们担心是有那个血块的形成，但是这个血块形成其实那个风险是非常的低，就好像1 million 里面1个，所以就好像你被雷劈到那个风险一样。但是如果你是有怀孕了过后生孩子，你那个风险那个血块其实高过你打那个 AZ 的疫苗，但是如果你加一起起来就变成比较高，所以是呼吁可以等6个星期到8个星期过后还打那个疫苗。 Alright， 这是可以打的，然后打了疫苗是不会影响到你的那个母乳，还有不会影响到宝宝。其实有一些小儿科他们是发现到打了这个 Pfizer 的疫苗还有其他疫苗，其实你身为妈妈你已经有那个抗体，然后你这个抗体就会排出来去你的那个母乳给宝宝。所以如果你是打疫苗的话，其实你不只是保护你自己，当你给你的宝宝那个母乳的话，你的那个母乳其实它是可以帮助你的宝宝得到那个COVID 的保护的。 OK， alright.
Interesting. So actually, Doctor, that leads to the next question from Kat. Will COVID antibodies pass through breast milk?
Yeah, so the question is, I answered this out in Mandarin. So the vaccine will not pass through the breast milk because the vaccine is actually a different type of agents that went into the mother's body, and once it go inside the body, it will create the antibody, which is the cells that fight the virus become more trained and prepared. So this antibody will actually pass through the breast milk and go to the baby. Okay, and one of the mom also asked about, is there any window period only can breastfeed the baby after vaccinated? Well, this is a very interesting question because a lot of patients actually we have a differing opinion. Okay, so means that for some ladies from Malaysia, the guideline was saying that they don't need for any window period. It's like once you have already once you already vaccinated, you can straight away breastfeed. But in Singapore, they have a guideline saying that no, after you breastfeed, you must rest like 5 to 7 days only before you breastfeed. So there's some differing opinion. But so far in UK, a lot of ladies, they have been vaccinated and they breastfeed, and actually there's no complication at all. And what Singapore have written about this rest for 5-7 days, they said is because of abundance of cautions. Means that they want to be more careful, but there's actually no scientific basis for having this decision. Okay, all right.
Okay, thank you, doctor. So now we've got a question from Nicole. 备孕的妈咪也可以注射疫苗吗？ So we're preparing for pregnancy.
备孕的妈妈呢
prenatal. Yes.
Okay. So 备孕意思讲你准备要怀孕 ，OK？ 准备要怀孕就是你如果打疫苗，你担心什么呢？就担心你不能怀孕，还是你担心怀孕了过后有问题 ？OK？ 所以这个疫苗其实是不会影响到你的怀孕的几率，反而如果你没有打疫苗，你就会减少你怀孕的几率。为什么呢？因为如果你没有打疫苗，你被感染到这个 COVID 的病毒的话，你就会有很大的问题，就是你呼吸困难，你可能你的那个血液有问题，然后如果是你没有进ICU 的话，你好回的话，你的整个身体也是会很弱，然后你也是会有这个很难要怀孕这个问题，所以备孕的妈妈是非常鼓励打这个疫苗，然后打了这个疫苗要几时还怀孕，那个很多时候他们在问 ，OK？ 但是所以我是觉得最好是1个月到3个月这个要隔离还开始怀孕呢。Can you talk? All right. Okay. All right. And
okay. All right. Perfect. So thank you, doctor. So now we've got a follow-up question from Kat. So does this mean that after vaccination and then breastfeeding my child, I can pass the COVID-19 immunity to him?
Yes, that is exactly what the Malaysian guideline has been written about. And after you have vaccinated, your antibody will go to the baby. And yeah, this is something that is happening, and they actually test the breast milk, the vaccine not in the breast milk anymore, but the antibody will go to the baby. And actually, this is one of the joke that my friend is making about. He was saying that his wife is a nurse, his wife already vaccinated and breastfeeding, and he himself couldn't get the immunity yet. So what he can do is to get the breast milk from the wife. Well, it's a good strategy, but not really advisable. Later, there's not enough milk.
All right. Okay. Thank you, doctor.
Okay.
So we've got another follow-up question from Samantha.
Okay.
If after vaccination and then there are mild symptoms of not feeling well, such as fever, body pain, can we still continue breastfeeding?
Okay, this is a very good question as well. Okay, Samantha. Usually, from my experience, I already injected twice Pfizer. So there are a few things that I think I need to tell you guys before you vaccinate. So First thing is you have regular exercise, but 3 hours before and after you shouldn't exercise, okay? And shouldn't take any hot shower or cold shower, okay? And you don't take any alcohol, don't cigarette smoke, and then you make sure you sleep well, okay? And take a lot of fruits to boost your immunity, okay? And to reduce the side effect, I use this, the cool fever for baby. Okay, so after injected, I actually put one cool fever on top, one cool fever below. Alright, and then it actually on the day itself, when they inject, no feeling at all. You don't have any feeling, bolasawan, alright? Then the next day it comes. It depends on your own body reaction. Okay, a lot of people, they will have fever, very tired. Okay, and the most severe is my colleague. They feel that they are being punched. Alright, it's like wow, like a lot of people punch you for the whole day. Okay, so this kind of side effect you cannot avoid because it's a side effect. Okay, and the main effect is to protect you from COVID. What is the main effect from COVID is dying. This is a medication to stop you from dying. So the side effect, of course, there's some struggle you need to go through. Okay, my best advice is you can still continue breastfeed. It won't have any effect towards the baby because you are not infected. You are being vaccinated. But if you are unwell, then of course you have no mood to breastfeed your baby, right? So what you can do is maybe you can express your breast milk, then you keep, and then maybe you have like your husband to help you out with the breastfeeding with the express breast milk. But if you are strong enough, you want to continue to breast milk and breastfeed, you can as well. There is no problem of breastfeeding after vaccination. Okay.
All right. Okay, thank you, doctor. So
you can sell our breast milk after vaccination. Well, you can technically.
Technically, right?
Yeah, but you need to go through the Ministry of Health because all the product that sell for health, you need to go through the Ministry of Health and to get a label. That's why a lot of ladies they like to ask us, this supplement can eat or not? That's the most common question. Then my most common answer is there is a few 100,000, maybe millions of supplements in this world. Okay, so we don't know. But the main thing is we look at the safety. Safety means you must have a Ministry of Health KKM logo or sticker saying that this is safe. This is confirmed safe, but whether does it help or not is not confirmed by Ministry of Health. Because some of the product supplement they like to overclaim. They're saying that this product can cure so many cancer this and that. So that is the thing. So breast milk, yes, there is antibody if you have expressed, but whether is it sufficient for an adult, we don't know. But for a baby, it has some protection as well.
All right. Okay, perfect. Thank you, doctor. So actually, the next two questions are the same. So if a breastfeeding mommy during her breastfeeding period accidentally gets COVID-19, does she have to stop breastfeeding, and after how long can she restart breastfeeding?
Okay, so answer in English or Mandarin?
I think maybe you can answer it
both.
Yeah.
Okay. I answer in English first. All right. So so you are breastfeeding, then accidentally you have the infection. Okay. So when you have the infection while you are breastfeeding, then we need to really screen for your contacts. Means that we see who that you're close contact with. Of course, the person who are closest contact with you is the baby. So there's a way of screening baby. Means we still the same now. We need to poke the nose and poke the mouth. Then we get the swab to check. All right. So if the baby is already positive, then you can continue the breastfeeding because both of you is positive. Of course, then for the ministry, usually they will see your COVID. Which type are you? Okay, because you have no symptom means that no fever, no other any symptom. No, you are fine. then you're like level 1, so grade 1. So grade 1 no need to go hospital. Grade 2 means you have some symptom but not so severe, you still can at home. But when you're grade 3, grade 4, grade 5 means that you need oxygen, all these things, then you may need to be hospitalized. Okay, then when you're hospitalized, of course, when you're unwell, all your breast milk, all these things, you are not suitable to be given to baby, but depends on the whole situation. All right. Second thing is like the baby, if it's negative, then if you want to continue to breastfeed, actually there's a guideline in UK was saying that you, and Malaysia also actually said you can, but you need to have some preparation. Means that you must make sure that the baby, of course, if you express breast milk is the best, because you don't like breathe to the baby. All right. But if you don't want to express, then at least you must wear the mask, and then you must make sure you clean the bottle properly so that it's not contaminated, and you can breast milk and make sure that you don't blow your breath to the baby. Baby can have a shield, something like that. So when you're breastfeeding, the breast milk has no COVID virus, but when you're breastfeeding, your breath will actually transmit the virus to the baby. All right. So you can still continue if the baby is negative, but with protection. But if baby is positive, then you can just continue breastfeed because both of you are positive and the baby need the nutrition. All right. So 我现在讲华语 ，OK， 答一模一样的问题 ，All right。So 其实如果你是中了这个 COVID 的话，然后你是在那个然后你才是 active， 就讲你还是可以感染到你身边的人，最靠近的身边人就是你的宝宝，因为你是哺乳者喂母乳，所以他其实是需要验他是有没有你的宝宝是有没有那个病毒。所以就是跟普通人也是一样，就是插鼻孔、插喉咙或者拿去验。如果是宝宝有了这 COVID， 你也有，这样要看你的情况。如果你是比较第一、第二期是没有症状或者有很轻微症状，你可以继续喂母乳没有问题。但是如果你是第3、第4、第5，你就要去医院，那个就看你那个整个情况方不方便，适不适合，你有没有那个能力来喂那个母乳。OK， 如果是宝宝是没有 COVID， 但是你有 COVID 的话，你还是在英国是讲，在马来西亚跟英国其实讲可以喂母乳 ，OK， 但是你需要做一些防备，就是讲如果能的话，最好是不要直接 latch， 就是直接喂，你可以挤你的奶出来后用那个清洁的罐喂母乳，因为奶水里面是完全没有病毒的。但是因为你喂这时候你的呼吸那些就会传染到宝宝，所以你需要的话就要戴面具，然后宝宝如果可以的话就有一个东西来遮着你呼吸的时候不会去到宝宝，然后你要准备那个整个喂的过程的时候你要保持你的卫生，你要洗心前你的手那些。所以总结来说，如果是宝宝如果也是跟你一起种，这样他也是需要那个营养，你可以给他喂母乳，因为母乳是妈妈的奶是对宝宝是最好的。如果他是没有 COVID， 你有 COVID 的话，你可以选择继续再喂，但是如果你不要传到宝宝，你就要宝宝给另外一个人，你就要隔离到医生说你没有那个传染的风险，你还可以继续喂回那个宝宝。所以母乳那个奶是没有病毒，但是当你接触到宝宝就会传染那个病毒。OK？
All right. Thank you so much for the explanation, Doctor. Very, very concise. So now we've got a couple more questions. If the baby catches COVID, is there any form of treatment or do they just heal naturally? And how long do symptoms last for the baby and will it hurt their lungs permanently?
Okay, so this is a very lengthy question and actually I am not in a position to answer this question, but I'll try to answer as much as I know, okay? So the COVID-19 virus, mainly it will hurt the elderly people, and for the younger people, usually there is not much of problem unless the virus is a lot, okay, very heavy. Then you can hear that some of the, I think Sabah, there's some children, and then I think there's one child, don't know what age, because she had the child had some other disease like leukemia, then they will die because of COVID-19. So usually the symptom is unpredictable, means how long it lasts. It can last usually 7 days or 2 weeks, depends. But for baby, because their immunity their healing are very fast, so sometimes they heal very fast. And whether they hurt their lung permanently, so far for the younger people, it doesn't hurt much, but there is a certain disease that they causes what we call this, they call long COVID. Long COVID means that they have some changes towards their blood vessel. So blood vessel clot very easily. And blood vessel is the one that supply a lot of organs. So when you have vessel clotting, sometimes you affect a lot of organ function. So because COVID, it's COVID-19, 19 means it started in 2019. Now it's 2021. It's only 2 years. So whether you ask me whether will it have long-term effect towards the child, we don't know. Because even if you're infected, if the baby is infected this year, now baby only 1 year old, we don't know whether when it grow up to 7-year-old, 8-year-old, will it affect the intelligence or all the other performance, we don't know yet. Okay, but for me, what I have heard or read is like, if the young people get this COVID, young means really young, like children, they usually have some blood disorder, clotting, all these things, which is many times higher than the clotting problem by AZN vaccine, which a lot of people magnify and got scared. All right. Okay.
All right. Thank you, doctor. So next question is, if mommy registers with My Sejahtera, will the government consider to assign the Pfizer vaccine for breastfeeding mothers specifically?
Okay. So this is not so Samantha have written, not sure if I asked a stupid question. There is no stupid question, okay? Never is a stupid question. You only remain stupid if you don't ask question, okay? So asking question is very important. All right. So, okay, the problem with My Sejahtera is a lot, but I cannot say it due to safety reason. All right. So when you register for the vaccine, did they ask you whether are you breastfeeding or not? Did they ask you whether you are pregnant or not? You don't, right? So if they don't ask you, they cannot assign. So what do they do is, when you go to the vaccination place, and then they will assess whether you are safe to get this vaccine or not. And then if you are not safe for this vaccine, then they will arrange for other vaccines. But so far for breastfeeding mothers, Pfizer is safe, AZN is safe, Sinovac is safe, unless you have other disease that make you unsafe for these 3 vaccines. So they won't assign specially Pfizer. But for pregnant lady, yes. For pregnant lady, the country recognized safe vaccine for pregnancy is Pfizer, to be injected from 14 to 33 weeks. However, we can see that AZN actually, the safety data show that it's also safe for pregnant lady if they are high risk. High risk meaning that they are not only pregnant, but pregnant with a lot of disease that if they are infected, they can die or they can cause harm towards their baby. All right? Or they are frontliner, which they have to have to go and meet a lot of people, like, not just frontliner, medical frontliner. Sometimes if you're in the sales or you're a hawker, you see like so many people buying food from you that actually, for me, they are actually high risk because they are exposed to many people. All right? Okay. So next question.
Yeah, next question.
Okay.
Kat is asking again, can young kids wear face masks, so not babies, I think she means a little older. Because some people say that it will reduce oxygen to their lungs. Is it okay if they just wear only face shields?
Okay, so it goes up to the question about the mask and the shield. Okay, I think recently you see the big news about the Prasarana boss, Tajuddin. It was just a face shield without the mask. Why? Because actually the mask close up where the main virus going to go in area, which is the nose and the mouth. Okay, and the secondary place to go in is the eye. All right. If the kids can wear the mask properly and it doesn't feel suffocated and the mask is not that thick, all right, it actually protect the kids better. And if can, for me, it's like one mask plus a tissue, which is the best. It won't reduce the oxygen to the lung. Okay, if you don't believe, now a lot of people trending like to buy the oximeter. You can ask the young kids to wear, then you check the oxygen. Actually, it doesn't reduce. All right. If it reduce, you can see the young kids will be having like hyperventilation, like maybe it reduce. So of course it's very subjective because some kids they have. I mean, normally kids won't have this kind of discomfort or difficult to breathe. But of course, some kids they have some lung problem or some asthma. Then maybe if you wear a mask, then you cause difficulty breathing. So if there's difficulty breathing, then no choice. You have to go for the second best, which is the face shield. But the best protection is still the mask. So a lot of times we cannot just say, okay, must have face shield, must have mask. Or just face shield, no need the mask. We have to look at the individual kids, whether which one is more suitable, and we have to balance the benefit and the risk. All right?
Hi, sorry. Sorry.
Oh.
I have a question which is related to kids, for young kids, which is whether they're suitable to wear the face mask. How about newborn baby? Because we have to bring them to hospital, all this. So I'm quite worried. I'm not sure whether it's okay for them to wear the face mask.
For newborn baby, no face mask.
No face mask.
Okay. Okay. Because I don't think you have such a small mask to cover the nose. And
I saw online they actually sell for newborn.
Very cute, right?
Yeah.
No. Usually the face shield.
Face shield will do, right?
Yeah, face shield. Okay. Because they are just lying down, so they don't really spread the aerosol as well. And then basically all the virus will just come down. So if you have face shield, it's very sufficient. But of course, if you're really scared, you can put inside the stroller, and the stroller have a layer of things that close. Okay. Mainly it's the barrier. The barrier will be more important.
Okay, thanks a lot.
No problem.
All right.
Yep.
Okay, great. Great answer, doctor. Okay, so our next question is mommy is saying that she has skin allergy problems during and after pregnancy, and now she is still breastfeeding her baby, who is 11 months old now.
Yeah.
Is she suitable for the vaccine with her skin allergy problem?
Okay, one of the most feared complication of vaccine is this allergic. Okay, but the problem with this allergic is unpredictable. Unpredictable means that you don't know who will get this severe allergy. All right, and then from our observation, those who have allergy, they don't develop any allergy to this vaccine. But those who have no allergy, they can have suddenly very severe allergy. So if you have skin allergy and you are breastfeeding, you actually should get this vaccine. Okay, but your vaccine, preferably you have to be vaccinated in a hospital or medical center. All right, and you don't have to worry about all this arrangement because you registered, and then when they see you having allergy, I think it's one of the questions in MySejahtera, they will straight away arrange you to be vaccinated in a hospital instead of a normal vaccination center. Because vaccination center, there's variable. Some is in the market, some in the hall, right? But you have to register first, and only then they can arrange for you. They are not that so like stupid. Just I already registered, so you go there and they'll just vaccinate you. No, you have to go through a few stages. They will ask you, do you have this problem? Do you have that problem? Do you know what were the complications? Then after you vaccinate, they observe you for half an hour to 1 hour, but usually half an hour. Then only they allow you to go home. You understand? It's not like you go kopitiam and just order kopi peng and just go back and drink. Okay, vaccine. You first need to register first, and then they will assess to see whether you are suitable or not suitable for the vaccine. All right. For breastfeeding, the best of course is Pfizer, but AZ is equally safe, and Sinovac can be considered. All right. Okay. All right. I think we ran out of questions.
No, actually, one just came in.
Okay,
so thank you, doctor, for the answer to the previous question. So the next question is, what should I do if my child was in contact and has symptoms of COVID?
Oh. So if your child has contact and symptoms of COVID, then the next step is to screen to make sure that to confirm that whether he has COVID, and then to make sure that since you suspect he has COVID, then better he must be isolated from other people, and then to proceed as usual. After confirm, then only the health personnel will take care of your child, and they need to screen you as well, because you as a mother, you'll be the closest to your child. Yeah. So for me, it's like if you suspect that the child has symptoms, you must immediately bring for screening and bring to see a doctor. All right. Okay, you're welcome, Jenny.
All right. Thank you so much, doctor, for answering that question. Oh, Kat has another question.
Yeah.
So will hand sanitizer and strong disinfectants every day hurt my child?
This one is a better question. Okay, suddenly I feel like I'm a pediatric baby doctor now. Everyone asking me about baby. Okay, actually I'm a gynae, female mother doctor. Alright, so about this sanitizer and strong disinfectant, I must tell you guys about the origin first, okay? This virus, COVID, is actually very easily destroyed by what? By soap, okay? So the main thing is still the soap and not sanitizer and all these disinfectant. So a lot of times we see a lot of people some of the mother for the school, they like to go in and spray the table, spray the wall, and I see some people, they before coming to hospital, they have this ritual like, okay, you turn one round, I spray your whole hair, everything. There's actually something wrong. And last time they have this door where they have spray and you go pass through. Actually, that thing can actually be harmful to the eyes, to the nose, to the mouth, to the skin as well. Alright, and it doesn't help at all in reducing COVID. Alright, it doesn't. Okay, so what is really necessary for a child is to use a soap, wash the hand, and then to use the soap, maybe more friendly, face-friendly soap, and to wash and to bathe regularly. And of course, the other thing is to teach your kids to wear mask, protection, and then maintain social distance. It's like if you stay very far from another person, the other person cannot spread the virus to you. You understand? The virus is not like magic. From there, disappear and appear to your child. So mainly something that really helpful is to have a distance, have protection, and to use soap rather than hand sanitizer. But if you cannot find the soap, then hand sanitizer is fine. But don't sanitize the whole body. It is not helpful, it's harmful, and it's not going to help. Alright? Okay? Does that answer your question, Kat?
Oh, I see. I actually did not know that that it doesn't actually help to.
No, it doesn't help. It's fun. It doesn't help. It helps the company that produce this kind of thing to earn more money, but it doesn't help.
Okay, all right. Thank you,
Okay.
doctor, for explaining that. Okay,
Okay.
so now we have another question from
Yeah.
Regina.
Uh,
Baby 的肥皂一样可以洗干净. So she's just basically asking if we just use
可以，
regular soap on
可以。
babies.
Yeah, 可以，你用肥皂就可以了的，所以其实很简单，就是肥皂，所以不需要那些很夸张的药物啊，那些alcohol 那些不需要的，不需要，只需要用肥皂，普通的肥皂 ，alright， 有肥皂成分，它就会就会消灭那些新冠肺炎的病毒 ，OK，alright。
Okay.
Welcome, Ken.
Okay. So yes, Jenny has another question. So after vaccination, can mummies bathe after they get home?
Yeah. By right, don't use any hot bath or any cold bath. But use a lukewarm, maybe body temperature bathe. You're supposed to bathe, so because sometimes you go to the vaccination center, a lot of people around there, so you bathe will be clean, alright? So yeah, just that some of the guidelines, from the scientific guidelines are saying that don't take any hot bath 3 hours before and after. So for me, I feel that you can take a lukewarm bath and then make sure that you soak yourself. The important thing is to soak, because soap is the one that's going to kill the virus, not the water. Alright? Okay.
Okay, use soap. All right, thank you so much for the explanation, doctor. So for our mummies, do we have any last questions? Because we're almost nearing the end of the tea chat. So this is time for like the very last questions. But in the meantime, doctor, do you have any maybe any last words, any words of warning or advice for our mummies today?
Well, very thankful for such a good audience today and a lot of good questions. Okay, because I find Malaysian asking questions is very rare. Because usually after a talk any question, usually no question, right? But today got a lot of questions, which is very good. All right. So a lot of time I think we tend to look at our WhatsApp and then our message, and we see a lot of video or this one all these are actually rumors and fake news. Okay, and I think what we need to do is to read the proper messages by the government, the doctor's profession, and not listen to this say bobo, this say bobo, then I tell you if they can I see all these things. So a lot of things, these are the fake rumors that people have been spreading. And a bit sad is that these rumors actually not just spread by the public. Some even the doctors are spreading this kind of fake thing because I cannot say anything about why they do it, but because when I read this kind of thing, it's actually very shocking. Because some doctor they share in the Facebook saying that, oh, I'm 60-year-old, I use this medication for the dog, and I get very well, these things then at the end what they introduce, oh, I have a course and you can join me in the course per person, you pay how much, it's okay. You can see that when they introduce something at the end, they actually ask you to join something. It's for some money benefit. So I feel that it's not right. Okay, but some doctors do it, and a lot of people they still tend to very scared, and then they tend to spread a lot of news, and they actually don't verify where is this news come from. Like this morning also, I received a message from my junior doctor. He was saying that, hey, this was Nobel Prize winner saying that if we vaccine now, we become a lot of this variant and will kill more people. I say, hello, in US, UK, and Singapore, Malaysia, most of the doctors already vaccinated. If this vaccine is going to kill the doctors, you are alive, there's no doctor to cure you. So it doesn't make sense. Okay, so sometimes you really need to think first, and if really the doctors is taking it, then it's safe, then you all should go for it. And then to really go for it is to register first. Okay, then of course to pressure your YB or your politics, anyone, to make sure that they can get the vaccine in. all right? Because you can see that Malaysia, they're running under this JKJAV, but Sarawak state government is buying it. Selangor is buying it. Penang is planning to buy it after the donation didn't pull through. So I think if you're in other states, you should pressure your state government to buy more vaccine. The only way to fight this is to vaccinate. Second thing is to isolate yourself. Be responsible. If you are positive, your family positive, please stay at home and then maybe order things through online. Okay, and of course the third thing is you don't avoid those who are positive. I mean, you don't go and hug him, of course, but let's say you know that your neighbor is positive, you try to support him or her as well. It's like, you need what food, I buy for you, I leave it in your front of the gate. Leaving things in the front of the gate won't cause you any COVID, all right? But if you don't do that, he or she will go out and buy food, and then he or she will spread the virus. So you see, by supporting others who have infected distantly, you are actually supporting yourself. Okay, don't like, oh yeah, COVID, I don't want to go and support him, I want to go far from him, don't talk to him. You don't talk to him, of course, but you can talk through phone. Now it's not, you can through WhatsApp, through phone. Okay, now it's very modern. So a lot of things we must plan ahead and then use our whatever that we can to fight this pandemic. All right? Okay? Yes. Any question from others? If no more,
I have one more question. Sorry.
can. Yes. You are Miss So or Miss Kai?
Sorry.
You are Miss So or Miss Kai?
Miss So.
So Miss So, yeah, can ask her.
I know this question could be funny lah.
No.
Because I instead of waiting for government to arrange all these vaccination, can we buy the vaccination? Can we buy it? Because
we cannot buy because it's not enough.
Not enough.
It's not enough.
So that's why it's quite slow lah.
There's many reasons why it's slow, but I couldn't say it out in open. All right, but you couldn't buy it because it's limited. It's limited edition. So I think that the government plan to disseminate to all the clinics, and for the clinic they actually have one program called Protect Health, where the government will give the clinic RM18 per injection, and the clinic not supposed to charge anything else to the patient. Means that it's free for you guys, and the government pay the clinic 18 again. If this program has started rolling very fast, then more people will be vaccinated. Because it's a spread, it's an MLM like that. Okay, 1 people give to 3 to 6 to 7 a lot. But now I think they have a lot of Sinovac ready after being packed and filled by Pharmaniaga. AZN, they have these Hunger Games for you guys to play and book. And then by the time after AZN finish, probably they'll roll out the Sinovac. So a lot of issues nowadays because Hajj, Haji, okay? A lot of Muslims, they want to go Hajj, but Arab only accept Pfizer, AZ, and other vaccine, but they don't accept Sinovac. And then for China, if you want to go China, you only can take Sinovac. They don't accept other vaccine. So it becomes something like a vaccine war, and then it's like Muslim, they don't want to take Sinovac, but then Chinese, they want Sinovac, and then it becomes something that very difficult to arrange. Because then what if you want to go Arab and you want to go to China? How? You need to take 2 vaccines, which is impossible because we have limited vaccine. So government is try to arrange for this kind of to go through this kind of thing, but at this point, what we can do is to pressure the government and to buy more vaccine. If we can get more vaccine, then it will be easier to get what vaccine you want and you can buy it. Of course, a lot of people are saying, I want to buy it. You can buy it, but then whether you have it or not, if you don't have it, you cannot sell it. That's the thing.
Okay. Thank you.
Sure.
All right. I hope that answered your question, Miss So. Okay, so thank you so much. Oh, sorry, we've got one last question.
Last question. Okay, from
Last question.
Samantha.
Mhm.
What is the shelf life of vaccine? Do we need to jab again after a period of time? Shelf life, I think I'm actually not sure. I need to check it out. I'm not an expert in the shelf life, but I think the vaccine they can last quite long if you keep it in their fridge lah. But once you take out, then you cannot keep too long, right? So do we need to jab again after a period of time? Yes. All right. So the period of time for what they reported is around 6 months to 1 year. So this COVID-19 is like a influenza flu jab. So the flu jab in our Malaysia we're not so common because nobody actually very rare die from flu, but in other winter country they die of flu. So every year they have this flu jab. So for flu jab is actually yearly. All right. So our vaccination the speed is very slow because someone estimated that if we go from our speed it will take 5 years to actually vaccinate 70% of population, because we need 70%, because once we reach 70% actually we can all take out our masks because everyone is low risk. All right, so yeah, then we need to jab again after 6 months to 1 year. All right, yes, it's a yearly jab.
All right. Okay, all right. So I think this is all the time we have for questions at the moment. So for mummies who have further questions, please feel free to reach out to Dr. Loh on his social media. It's Gynae Penang on Facebook, Instagram. So that's GYNAE PENANG. So Gynae Penang.
Yeah, I type in the chat box. All right.
Yes, and his website as well, gynaepenang.com.
Yeah. Okay. Thank you, everyone. I'm going to put this into my YouTube channel. If you like it, then you just come and visit. There's a lot of information about COVID-19 in pregnancy, the vaccine, the Pfizer vaccine. Exact, I haven't updated yet. And there's 5 things for you to do before your vaccination. If you're interested, you can just come and pop into my channel. All right. Okay.
Thanks a lot. Thank you.
Bye-bye. Thank you, everyone.
Bye.
Thank you, Miss So. Bye-bye.
All right. Okay, so thank you so much, Dr. Loh, for your time, and thank you to all the mummies who joined us for our tea chat today. So we hope you learned something and have a pleasant. Once again, if you wanna catch Dr. Loh's YouTube videos, his YouTube is Dr. KP Loh Gynae Penang. So you can just search for that on YouTube. All right. So thank you everyone for joining us today. See you.
Okay, we come to the end. If you like this video, hit the like button, hit the subscribe button, and smash the bell, and then share it all away.